So in our Core 1 foundational 4-day course, what we're actually doing is we are introducing the doctor, whether you're non-experienced, meaning you've never placed an implant, to someone that is somewhat experienced with placing dental implants. We're going to give you the didactic will be how to size your implants, implants to use, where we're going to place them. One of the nicest things though about Core 1 is we start talking about restorative dentistry first. Because look, an implant is just a screw. It's just really honestly nothing that magical about it. The question is, if a person is going to get implants, well, how are you going to restore it? And restorative actually is based on a couple of things. It's based on the bone that the patient has. It's based on the amount of space that the patient has. What we call fit. How much space is there? Does the bite need to be open? Is the bite over collapsed? Because if it is, and if you place an implant in a situation like that along with the crown, if the patient's bite or the joints are unhealthy, you can end up actually having a problem with the implant down the road where it can actually fail. Implants usually fail due to gum disease and or heavy occlusal forces. But anyway, we start off with restorative dentistry. We'll talk about the basic implant procedures, meaning there's a fresh site placement, meaning a tooth has been taken out, been healed, we place in let's say in a ridge. There's what we call the immediate implant, meaning you take out a tooth and you actually place the implant the very, very same day. Often in the immediate implants, we can actually give you experience in actually how to load it that day, meaning put a tooth on it. There's what we call the sinus butt or a crestal sinus lift, meaning that if you have deficient bone in the back, we can show you actually how to place often a longer, wider implant into those particular areas. And there's also the no drill implant or the drillless technique, meaning that there are some cases, particularly in the posterior or in the back, where you can actually place an implant without even having to use a drill. So we go through these things through Core 1, but one of the nicest things about it is that, anybody can read about these things in a book, but the most important thing is actually getting patient experience. And on the first day, you will actually place your first implant. We try to get you maybe at least 1 to 3 that first day, fresh sites to kind of warm you up after a day of lecture. The second day, the morning, we'll have a morning lecture. Then in the afternoon, just like the first day, we will do extraction immediate placements. Because often in many cases, if you're actually going to place a immediate implant, you can't afford to break the bone, the buccal bone. So we teach you with the piezo or certain techniques on how to preserve as much bone as possible to place the implant. The third day, we'll try to get you an arch, meaning anywhere from 4 to 6 implants and stabilization. And on the last day, we try to get you 2 arches where you can actually restore a whole mouth, at least place the implants. Often on that, what we call that 3rd and 4th day, which is Sunday, Monday, the patients will be under either oral sedation. So if you've not worked with patients with oral sedation, you get that experience. If the patient has, if you've never worked with a patient under IV anesthesia, we have anesthesiologists who often put our patients to sleep, and you will get a chance to work under a situation where the patient is totally knocked out. One of the nicest things about IVs, you also realize too that just because the patient's knocked out, it doesn't mean you're supposed to take all day to do the case. So we give you a variety of experience just on that first course, along with the didactic knowledge, to get you to where, if anything, you'll know what cases not to attempt, but the ones that you do, you should be able to at least do 50% of the implant cases that come into your office even after the first weekend. Any of the doctors that should attend day 1 are those that have minimal to no oral surgical experience, including implants, and even those doctors that have actually said that they actually have a lot of experience. I've actually had patients or doctors come to our course that were actually specialists. One was an endodontist, one was a prosthodontist, another one was a gentleman that one of the implant companies that we kind of said, hey, send us one of your best doctors. The gentleman's had a lot of experience, and we tend to find that even those that have said they've had a lot of experience, by the time they go through our first day or second day, they realize that they still have a lot more to learn. So honestly, I would basically say if you probably have placed less than a couple hundred implants, this course is definitely something you're going to learn from. I also think too, even if you're a pretty experienced doctor, is that you'll actually get a chance to learn the different type of diagnostic techniques that we use to actually determine the type of denture prosthetics. Because again, there's more than one way to restore a patient, or as I say, there's more than one way to skin a cat. I think really, again, unless you're somebody that's placed a few hundred implants, you're definitely going to get something out of this first Core 1 course.